Breast cancer is a disease in which malignant cancer cells form in the tissues of the breast. There are many different types of breast cancer that can affect both women and men. Breast cancer is the most common cancer in American women, except for skin cancers, and the second most common cause of cancer death in women behind lung cancer. Breast cancer caused 685,000 deaths globally in 2020. The exact cause of breast cancer is not known, but some factors may increase the risk of developing it. These include age. The risk of breast cancer increases with age, especially after 40 years. Family history. Having a close relative with breast cancer may increase the risk, especially if they were diagnosed before menopause or had cancer in both breasts. Genetic mutations. Some inherited mutations in genes such as BRCA1 and BRCA2 can increase the risk of breast cancer and other cancers. These mutations are more common in certain ethnic groups, such as Ashkenazi Jews. Hormonal factors. Having early menarche, first menstrual period, late menopause, or never being pregnant may increase the risk of breast cancer due to longer exposure to estrogen and progesterone. Hormone therapy after menopause may also increase the risk. Lifestyle factors. Being overweight or obese, drinking alcohol, smoking, or being physically inactive may increase the risk of breast cancer. Environmental factors. Exposure to radiation or certain chemicals may increase the risk of breast cancer. The early detection of breast cancer through annual mammography and other breast exams is the best defense against receiving a late-stage breast cancer diagnosis. Generally speaking, the earlier the cancer is detected, the greater the likelihood of a successful outcome. The 5-year relative survival rate for cancer diagnosed at the localized stage is 99%. The treatment of breast cancer depends on the type and stage of the cancer, as well as the patient's preferences and overall health. Some of the common treatment options are surgery. This involves removing the tumor and some of the surrounding healthy tissues, lumpectomy, or the entire breast tissue, sometimes including the nipple and the pigmented area around it, mastectomy. Breast reconstruction may be considered using implants or one's own tissues after surgery. Chemotherapy. This involves using drugs to kill or stop the growth of cancer cells. Chemotherapy may be given before or after surgery to reduce the size of the tumor or prevent its spread or recurrence. Radiation therapy. This involves using high-powered energy rays to destroy cancer cells. Radiation therapy may be given after surgery to kill any remaining cancer cells or prevent recurrence. It can be done using a machine or by implanting a radioactive material inside the tumor mass. Hormone therapy. This involves using drugs to regulate the proliferation of hormone-sensitive cancer cells and prevent the production of hormones or reduce their action. Hormone therapy may be given after surgery or chemotherapy to prevent recurrence or as a palliative treatment for advanced breast cancer. Targeted therapy. This involves using drugs that target specific molecules or pathways involved in the growth and survival of cancer cells. Targeted therapy may be used alone or in combination with other treatments for certain types of breast cancer that have specific genetic mutations or markers. Immunotherapy. This involves using drugs that stimulate the body's immune system to recognize and attack cancer cells. Immunotherapy may be used for certain types of breast cancer that have specific genetic mutations or markers that make them more visible to the immune system. The prevention of breast cancer involves adopting healthy habits such as eating healthy and nutritious food, avoiding alcohol, practicing gentle exercises upon doctor's advice, visiting doctor for regular examination. Preventive surgery may be recommended in women with high risk. To reduce the risk of developing cancer, get the pre-screening done. I hope this information is helpful to you. Please note that I am not a medical professional and this is not medical advice. It's crucial to consult a healthcare professional for a proper diagnosis and treatment plan. Thanks for watching. Please do not forget to like this video and subscribe to our channel Better Healing Approach.